sniffling, you're sneezing, you got a lot of snot, you're not even sure why. What in the world are you to take? Well, there are so many options when you go to the drugstore, and there's different biases across the board. I'll tell you, when I have the runny nose, as you guys know, I'm all about saline washes, the neti pot. Use it first thing in the morning before I go to bed and as needed throughout the day, because it's just salt water.
Exactly.
But other people, I mean, there's a lot of options out there.
The over-the-counter, you know, and kind of what's the difference between an antihistamine and a decongestant? A lot of parents don't really know how those, they actually do two different things to the nose. If you've got that faucet nose, that itchy is just running, clear runny nose,
mainly.
and you're sneezing a lot, that's what an antihistamine really hits. It hits that itch in the nose, and it'll stop that clear runny nose. It also puts you to sleep.
And you're mainly going to have that clear runny nose if it's more of an allergic type of reaction. And they can cross over pretty easily.
Sometimes a cold will do that too, but
But for colds, people will always ask, what do I grab? First thing I have to emphasize to anyone at home is a lot of the products, they have multiple ingredients. You don't want to combine, because if you get one product that says this is great for cough and cold, you buy another one that's great for cough and cold, you're probably combining products and you're going to get potentially an overdose in some of these things. As far as decongestants, what they do is they constrict the blood vessels, and that will help reduce some of that swelling of the nasal passages. The reason that I don't take them is because it makes my heart race.
Oh man, it amps me up.
It does. It's a stimulant. And so some people don't tolerate that very well. So if you're going to take a decongestant, what I always say is take it earlier in the day if you don't tolerate it later. And
especially in kids, you know, they will amp the child up, and you probably have a sleepless night ahead of you.
So beyond what's in the pills, let's talk about the different types of pills.
Right, there's so many different types. Gel caps, the tablets, you can even get chewables and things like that. And these are definitely just preference. You know, I like gel tabs because sometimes they go down a little bit easier and you have less of a flavor. Some people gag on the flavor.
And the gel caps are theoretically absorbed more quickly, right?
Yeah,
but enteric-coated aspirin, it's that way for a reason. If it upsets your stomach, then it will be absorbed later once it gets through that area. So let's talk about something that so many people ask us about every day. Supplements when it comes to omega-3s, et cetera.
Yeah.
You hear, you know, the omega-3s, omega-6s, omega-9s, you know, what's the difference? And people want to know. And the difference between a 3, 6, and 9 is really just the chemical structure of the molecule. Now, they're all good for you in the right amounts. Now, the 9s I usually don't worry about, because actually your body makes omega-9. So I don't even worry about omega-9s. Now, omega-3 and 6s, we call those essential fatty acids because your body can't make that. It's essential that you take them in your diet. The omega-3s tend to come from fish and flax. Omega-6s tend to come from nuts. All right, and
a lot of the other products.
And a lot of the other products.
Animal products.
Yeah, and you know, a lot of the junk food even, the omega-6s slide in there. So we get a lot of omega-6s. As a matter of fact, we get way too much omega-6 and not nearly enough omega-3s because nobody's eating fish. So it's really important to try to kind of go back and get the right amount.
So let's talk about the supplements then, because what we all have found is that it seems like we have a displaced ratio, too much omega-6 as compared to omega-3. And if you're way out of proportion, that can be bad for your health.
Yeah,
so that's why a lot of doctors, after they talk with you, if you're at risk for heart disease, may say, you know what? Maybe you should take an omega-3 fatty acid supplement.
Right, so then you go to the drugstore and you see the omega-3s, but then you also see omega-3, 6, 9. You think, okay, that might be better. I'd rather you just take a fish oil supplement. That way you're getting, it's more like real food.
And I cannot emphasize this enough. When you go to a drugstore and you buy a pill and you start taking that pill, in my opinion, all of that information should be shared with your doctor. These things can be dangerous if you don't take them in the right amounts. And so talk with your doctor about all the supplements you're taking. Before we go, Dr. Lisa, the one thing that you do, put your arm around her, is you hang out with 3 guys each and every day. And, you know, what in the world's the difference between antiperspirant and deodorant?
And the difference is, and these guys always
You've been needing
smell
to tell
good.
us that for a while.
Yeah, they always smell good. Antiperspirant, it's just like what it says, actually. Antiperspirant keeps you from perspiring or actually sweating, whereas a deodorant actually hides the smell. So it's a deodorant. It's for the odor, deodorizing you.
And most of them have both in it?
Yes.
A lot of them do?
Antiperspirant and deodorant, yes.
Good stuff.